Hi, my name is Taylor Salkind, and I am currently struggling with complex regional pain syndrome, fibromyalgia, and then I also have anxiety and depression as well. Before InterX, I would say that I really did not have a life. Honestly, my world was surrounded by the pain that I was experiencing, and at the age of 12, about to turn 13, I didn't have a life. I did not have friends. I was suffering from things that I did not know how to explain, and none of my peers obviously were going through the same thing, so it was very hard for me to even relate to anyone. I was not really living my life.
My name is Emily Tekla. I'm 13, and the reason I started going to InterX was for alopecia, and while we were there, I started experiencing chronic hives. I was losing hair, and that was causing me to leave school multiple times a week for doctor's appointments. And then when I started experiencing the hives, I was in pain every day. My sleep was crazy. I'd go to bed early and wake up really late. I was having depression from dealing with that all day, every day. It wasn't fun.
Taylor wouldn't get out of bed prior to InterX. The pain never went away. She would cry all night. She was almost impossible to get to do anything. She was always afraid that if we did go somewhere that somebody would bump into her or hurt her or just stare at her the wrong way. She couldn't walk on her ankle. She could barely move her wrist. She was struggling in school. She couldn't do cheerleading anymore. It was just an overall nightmare.
Devastated about the alopecia, and watching your child be covered in hives 24 hours a day, every day for 6 months was just, there really aren't words to describe what it's like to watch your child suffer. And I know that there are many children who suffer much worse than that, but as a parent, watching your child just be itching and hurting and just feeling bad every day, it was horrible.
My name is Sarah Martinez. My daughter's name is Bella Martinez. My daughter was diagnosed with CRPS. She was around 12 when she was diagnosed. Before that, she was incredibly active. She liked playing volleyball. After she was diagnosed, that obviously all changed. Originally, she broke her finger playing volleyball, and then she hurt her knee. She was in a lot of pain. Everything changed. She couldn't go to school anymore, and she even struggled to just go to her bedroom. Just little things every day was really, really difficult. She couldn't be in the car for very long. Anything that shook her was a lot of pain. We started to notice that the pain was just spreading to her other leg, to her hands, to her body. She couldn't function anymore. And
when I was losing the hair, I was thinking about oh, am I gonna have to wear a wig my whole life or whatever? And then with the hives, I was wearing long sleeves and leggings almost every day because I was trying to hide it, and I would put concealer all over my neck and face trying to get rid of it.
I think that when the alopecia popped up and then the hives popped up, we got to a point where, we trusted God. We watched God heal Emily of the alopecia, but there was just still that fear. There was just still that fear of what's going to happen next.
One day I went into her bedroom and she was in shorts and she was standing by her closet. And I just remember her knee kind of caving in, and it looked, I don't want to say deformed, it just looked like it wasn't right, something was really wrong. And I think that's when it hit me that this is actually getting a lot worse. It's not getting any better.
I did not see myself living past the age of 18 years old. I struggled with depression so badly. I did not see a future for myself. And at one point in my life, I did not want to be here. I was extremely depressed. And I even have told my parents, I would not be here had my life not changed.
I was so afraid every time she told me, I don't want to do this anymore, I don't want to be here, that I would not have a child, that she would eventually not be here. And as a parent, that is the scariest thing you will ever encounter. And the reality is CRPS is the suicide disease.
When we left the Mayo Clinic, they prescribed her gabapentin. We were hopeful that the combination of the gabapentin and the physical therapy would help her, But the more that we gave her the medication, she would just become completely leveled, like she couldn't function anymore. And I don't know how I came across it, but there was, I guess, a story or like a testimonial from somebody who used InterX. And I actually reached out to the people that sell them, thinking that it was like some kind of TENS unit, I guess. We didn't really care. We just knew that it wasn't invasive. There was no narcotics involved. And we thought, why not?
Emily had a staph infection for which she took antibiotics, and the antibiotics triggered alopecia because she already having autoimmune issues. Alopecia is very similar to vitiligo, and we were concerned that she would also lose all of her hair. So we hit it really hard. And the InterX was really the main treatment. We also changed diet and some things like that, but InterX was really the main treatment that we were doing to help reset her immune system so that her body would not be attacking the hair follicles anymore.
I think the first time we went, it was kind of weird the first time we went because I didn't know how any of it worked. And so I was I was pretty shy. And it took me a while to warm up to her, but we started with the hair and then it started growing back.
Her hair grew back in, never had another problem with it since then. But about a year later, she broke out in hives one day and had chronic hives every day for 6 months. And then they began to lighten up.
We probably tried every type of medication, nerve blocks. I did the ketamine infusions, physical therapy, chiropractic care. I think those are the ones that I can think of off the top of my head. I know medication was something that any doctor you went to, they would throw at you. And if that didn't work, then it was okay, oh well, I can't really help you. And I know at that point, at the ripe age of 14 years old, they really wanted me to get a spinal cord stimulator, but I was that's just not happening. So any treatment possible, we probably have done it at some point. But it really wasn't until InterX that I actually had some type of change in my life.
So we moved into the Ronald house for 6 weeks and we started InterX Therapy. Walked in the first day to meet Janice and the whole team there. We were just so shocked that as miserable as Taylor was, because she was miserable and she hurt for days. And Janice was so sweet and she literally would speak so gently to her and explain everything to her and talk with us while we were there every day for those 6 weeks. And she told her everything that was going to happen and how it was going to go about. So we learned to eat differently and do different things. And I remember Taylor would go back to the Ronald McDonald house and just lay in bed and cry.
The first few times that we went, she couldn't even go near the leg for sure. There was parts of her other leg she still couldn't go near, her hands. But she focused a lot on her gut, on her scalp, on her opposite leg when she could, her arm. We also focused a lot on detoxing Bella from some of the medication that they had. But it did take Bella some time to get off of that medication. I think that her body had already become dependent on it, I guess. Janice helped me a lot with that. We used the machine a lot to do that, especially during the first 2 weeks that we were there.
When the hives started healing up, I physically felt better because I wasn't itchy constantly and I wasn't self-conscious about having red dots all over my skin, and my sleep got back to normal and I just overall felt better.
She would only have them at certain times, certain things would trigger them and they would be short-lived. But throughout both of those processes, we had lightened up on our InterX in between the two, and she's been hive-free for about a year now.
And one day, I think she was laying on the InterX table and she just looked at me and she goes, "I feel so good." My life changed that day because I'd never heard that from her in years, in days. All I heard was her, "I hate this, I can't do this, help me, fix me," or those things. And that was altering for us.
Her life has just completely changed. She stopped using a wheelchair within the first few months of seeing Janice. Probably one of the first things I noticed was that she started being able to grip a pencil. The way she laid, even the way she crossed her legs. The balance definitely came first with her walking, her being able to stand up, her being able to straighten her leg. She didn't used to be able to do that before. So yeah, there's a lot of things like that we couldn't have imagined that we would have been able to do.
It wasn't until I think the 4th week, right before we were about to go home, that things actually started to change for me, where I felt lighter. I didn't feel as inflamed. I mean, my mom would always say, your face looks like huge. Not huge, but like definitely could see the difference in my face where the inflammation was definitely going down, and I was a lot happier. During that time, I experienced a lot of anxiety and a lot of depression, but once I was able to get like some type of decrease in pain, I mean, my world really shifted.
I think a lot of times when people are struggling with health, it's because their body doesn't have the support that it needs. And InterX is one way that her body has really been supported. And Janice has really helped walk us through that with both the InterX therapy and just the other knowledge that she's poured into us of other ways to support Emily's body.
It took me a while to warm up to her, but like now when we go in, we just have like goofy conversations and like updates on life, and she like pours into me also like in the spiritual sense, and like talks about like how my testimony is going to help other people someday. And it's like very powerful to see like how God's working in me.
I think with any parent who has a child that has a genetic condition or a neurological condition, I feel like there's not a lot of help sometimes if it's not like really harsh medication. And I feel really relieved that there's something out there that is non-invasive, non-habit forming. And I have a lot of relief knowing that she can continue doing this into adulthood. Like my kid is not a kid anymore. She's going to be an adult. She's going to college. Basically, we've learned she's going to have to take into adulthood. So I have a lot of relief knowing that even if one day she gets sick, she's in pain, she's going to know that she can reach for that instead of taking ibuprofen. Like she prefers anything that is not medication. So I have a lot of relief knowing that there's something different out there and that there's an understanding, because even Janice was incredibly knowledgeable, not just about CRPS, but about EDS. So I have a lot of relief knowing that there are people out there that understand that condition.
I really did not have a whole lot of hope, and I did not think that I would be here to this day. It was world changing for me just to have that slight decrease in the pain instead of being at a 10 out of 10 pain all the time. It made such a big difference in my life. The impact on my mental health, my physical health, everything definitely changed. My point of view as well, because I mean, my mom can tell you as well, I was very negative at that point. Even going into it, how people said how good it was for you, I was like, it's not going to work. It's going to be like every other thing that we've done. And it's going to be another thing that I don't want to say wasted our time doing, but at that time, that's probably how I felt. But once I was able to get like some type of decrease in pain, I mean, my world really shifted.
We're so thankful that, that my friend several years ago led us to Janice, and that the way that God has worked through her and the way that she encouraged us, not only through the InterX therapy itself, but just who Janice is and just the way that she would encourage Emily. We still, honestly, at this point, I don't really think that we need to go to InterX, but we go once a month because for me, it's good for her body, but it's good for her soul and her spirit to just sit there, for us to sit there for an hour with Janice and just have Janice just speak life over her and just pour into her. And it is just, Janice has become like family to us. We love her so much, and Allison as well. And we just are so thankful. As a parent, when you see people pouring into your child, it's just, not only has the therapy itself been life-changing for Emily and for our family, but Janice, just the way that she loves, has been something that, it's affected us forever.
I just want people to know that InterX gives you hope. InterX gives you a lot for what it is. And you have to believe and you have to trust Janice if you have any idea of what I'm telling you is true, because it really is. And hope is the only thing that we have in life that we really need to believe in. And when I see kids out there and, and their parents in the same position, I'm like, you need hope, and you have to believe that there is something that can help you. And I tell them all the time, go hit up InterX. It may be in Texas, but it's worth it. And don't quit. Don't stop fighting for your child. Don't stop advocating for your child. And don't ever, ever quit. If I had given up when she did, we wouldn't be here today. So just don't quit.
We're indebted to Janice and InterX forever. I mean, she gave us our kid back. And I think that considering where we were at the Mayo Clinic, we're in one of the biggest pediatric centers in the country, and they had no clue. They basically just educated us, not even to the extent that Janice did, gave us medication and left. So I am just incredibly indebted to her team. And like I said, I couldn't be more thankful. I couldn't be more grateful for everything she did for us.
I have hope now. Like, I actually see a future for myself. I mean, at that time, I think I was 14, about to turn 15. I did not see myself living past the age of 18 years old. I struggled with depression so badly. I did not see a future for myself. I mean, I'm 25 now, so I definitely made it past way further than I did. I just graduated college. Like, I've done everything that I expected myself not to be able to do. So everything really has changed for me. And I don't know, I get very emotional talking about it just because I really just did not expect myself to even be here at this point. So it's very encouraging, and I hope everyone, whoever gets to see this, like, knows that, like, there's more things for you and it's not the end of the road.